Hi holograms, it's new. So I haven't done an update in a while. Those of you who follow me on other things already know about all this, but I wanted to make a little video just to talk about things. So 2021 was a really bad year for my spinal health, and I have been indicated for spinal surgery. That whole process has been traumatic itself. I had to have an epidural steroid injection, like an epidurography. The doctor had to stop the procedure early because it was so painful and it didn't relieve any of my pain, the steroid injection. I just had a terrible flare-up. On top of the flare-up I was already having, couldn't move my neck, and now my mid-spine is even worse. I do have some thoracic instability and some scoliosis. I've been having terrible sciatica, which is a new thing for me. I've only been experiencing sciatica since 2019, so now it's just like full-blown, and I can only sit up like this for a short amount of time. I've been really strict in staying reclined in this chair. I have my little floor desk set up, so that makes it a lot easier, but it's still really painful. I'm having trouble sleeping because it's just hard to get comfortable with all of this, and I can only work. Lately, it's just been one day a week. Even though I've been indicated for surgery, the first neurosurgeon that I talked to was just a total jackass. He barely looked at my MRIs, and he was like, no, these herniations are tiny, I don't really see any problems. I was like, well, what about an annular tear? It doesn't matter how tiny the disc herniation is. If there's a tear, disc material is leaking onto my nerves, and that perfectly explains and describes the pain and progressive disability that I've had over the past 9 years. On top of, the giant bone spurs, which are really obvious in my neck. So I am seeking a second and possibly third opinion. The whole process of getting insurance to send me is just also so traumatic, like having to constantly call and fix authorizations and fight for them to get me the right doctor, because for the first 3 referrals they kept trying to send me to a pediatric surgeon. It's just, I don't know, this country is so broken, like the insurance, you guys already know. So anyway, because I've just been progressively like worse and worse and worse and not able to do much and falling behind on my expenses and my medical stuff, my therapist did suggest to me many times, like, maybe you should make a GoFundMe. Maybe it would help. It can't hurt, right? And so I calculated the cost of getting the ketamine infusion therapy, which is the therapy that I had in 2020. And I only got 3 infusions that were quite spread out, so I only got just a taste of what it's like. But even then, it reduced my pain, my energy was up, I was working like 4 days a week, which is a lot for me. So I'm like, okay, in the meantime, while I'm trying to figure out this surgery thing, I need to try to get infusion therapy again. And it is $500 per session. My insurance won't cover it again. I am going to still try to fight with them. I'm talking to my pain management doctor about it. Like, look, this surgeon says surgery is not going to help me. Maybe we can use that as leverage. But I still need to talk to a couple more surgeons. To do it properly, you're supposed to get 2 infusions a week for 3 weeks straight, and that would stabilize me. That would reduce inflammation, pretty much numb the pain completely, and get my energy up, and also it helps with depression and PTSD and everything. So those first 3 weeks is $3,000, so that's my first goal on my GoFundMe. My second goal for 1 year of treatment would be $9,000, and then $15,000 is the big goal. That would get me 2 whole years of treatment. I believe that will be enough time for me to get back up on my feet, because at this point, back brace constantly, cane constantly. I've had to use the cane around the house, and I don't have much help like doing things, and so I haven't been eating a whole lot because I can't cook. I can't stand up to cook. It's been water and smoothies and microwavable stuff, and even then, like with the nerve pain that I have, trying to open a can of microwavable food and then lift it up to the microwave, and like, it's too much for me. I get exhausted from taking my pajamas off at this point. So far, since making my GoFundMe, I have gotten 23 donations. So we're at 1,325. So almost halfway to my first goal of 3,000. I wanted to try to get to my second goal, the 9,000, for a whole year of treatment before I actually started treatment. That way I could be sure that I had enough to keep covering the treatment. But at this point, I may just go ahead and start it as soon as I get 3,000 to 6,000, because I need to get stabilized. Like, this just isn't sustainable anymore. I work really hard on my content and other things to get donations for my J-pop translations and people who like that stuff, and on my Patreon, but it's really not a lot. Like, I make about $42 on Patreon a month, I think, and I get it, you know, we're all struggling, but I was just blown away to have even received over $1,000 on my GoFundMe within a couple of weeks. So I'm really, really grateful, and it's really encouraged me to like, okay, I can relax, I can take more time to rest. And tricky because if I have to run errands or take myself to doctor appointments, that's just even more pain. And I'm just trying to balance it all still. I have had to make the decision to stop buying all the supplements that I take that keep me afloat. You know, I take so many things like fish oil, and just I live off of supplements. You know, I don't know what I would do without them, especially because of all my gut stuff and my energy levels and things like that. Managing colitis itself with the bleeding and everything takes a lot of supplements. So the link to my GoFundMe is going to be in the description down below. If you can't donate, please at least share it. I'm trying my best to do this, and I can't do it on my own anymore. And that's something that has been so hard because I've always just kind of been like, well, you know, I have these health problems, but it's fine, I'll do it. And then I like overdo it and push myself and have these even worse flare-ups because I'm not able to rest as much because I was trying to like afford all of my things by myself. In the meantime, since I am only working about 1 day a week, on my days off, I'm really prioritizing rest and self-care and staying reclined most of the time. I try to stay up a little bit, like if I need to eat and stuff, it's just healthier to have things go down for the acid reflux. And the rest of the time, I'm reclined with my keyboard on my lap, just still editing because I have such a big backlog. So if you still see content coming out, a lot of this content has been recorded like 2 years in advance. So just keep that in mind. Even if it may seem like I'm still really busy and pumping things out, it's because I'm always editing something from a long time ago. Okay, well, it's time for me to get reclined again and take a rest break. Thank you so much for watching. Thank you so much for all of your support over the years. Please make sure to follow me on Instagram, TikTok, Twitter. I do post a lot more real-time updates there. I do still want to do a vlog about something important soon. I want to wait until the sciatica chills out because the longer I sit in that chair vlogging, the worse it gets. I'm doing my best, but yeah, thank you so much. It means the world to me. Please take care. May the spoons be with you. Bye.